One of the University of Sydney's strengths is that it has a very large number of great doctors at all of its clinical schools. A lot of those are at Royal Prince Alfred Hospital, so it's been really nice to have exposure to them and also to realise that they're very real human people who were once medical students too, and in general they've been extremely supportive and willing to share their time and experiences and help us as we're learning.
In many disciplines we have leading researchers, leading clinicians known both nationally and internationally.
You really get access to patients who have conditions from the most simple to the most rare, which is great as a student in terms of it's good to still get the bread and butter work, which really is what we are trying to learn as a student, but it's also very exciting and very interesting to see the rarer cases, be they medical or surgical. You can see everything essentially at RPA.
This is no doubt a centre of excellence. I mean, if we look at this, the health service itself, we've got 800 beds, 10,000 staff. This is a massive campus. We've got a new cancer hospital. The research here is absolutely outstanding. We've got all of the medical research institutes, virtually on campus. We've got the new Charles Perkins Research Centre here, and we've got the biggest concentration of clinician scientists anywhere in Australia.
No matter what you're interested in, you'll always find something on the wards or in theatres or in the clinics which sort of sparks your interest.
So many different things that you can experience here, and your time here is really facilitated well by the clinical school staff, and the practitioners are very enthusiastic and they love teaching, and I think it's definitely lived up to expectations.
In general, one of the things that I really love about medicine and have found to be the case at RPA and at Central Clinical School is that doctors are really encouraging if you express an interest in their field. So in almost any rotation there's a chance to try and attend additional outpatient clinics with the doctor, maybe see a patient first and then present it to the doctor. I've had doctors just recently express a lot of interest in trying to encourage me to prepare for my long case exams, for example, and so they'll spend time, even at the end of their very busy day, to sit down and listen to me present a case, then provide really great feedback.
So the teachers and doctors here at RPA are second to none. I've been through every rotation in first and second year here, and just every block I get the best in the world sort of teaching here. It's fantastic.
You're not just at RPA, you really move around a lot. So as a student at the Central Clinical School, I've been to RPA, I've been to Canterbury for obstetrics and gynaecology, I've been to the Westmead Children's Hospital for paediatrics, I've been to Concord for psych, and I've also done GP placements in the city and also in the country. So you really do move around a lot, and I'm soon to go to Balmain for geriatrics. So you're not just restricted to one hospital, you get a lot of different exposure from different hospitals.
We also have introduced to the teaching a clinical teaching program. It's a set of workshops aiming at teaching students and then junior medical officers how to teach.
By asking the junior staff to do a lot of our teaching, they're people who are at the top of sort of their learning. I mean, they're about to do their own exams for the College of Physicians, and so they're at their peak of their knowledge about medicine. Not only that, they've learnt this fairly recently, whereas the consultants like myself, we've learnt this many years ago, and I've often forgotten the steps in how we got to where we are. So we can show them things by experience, but we're often not as good at teaching as their peers and their sort of recent, the people just a year or two above them.
The teaching at Central Clinical School will depend on what type of block you're doing. When you're doing a specialty block like the perinatal and women's health one that I did at the start of this year, there's a really great, very well structured program organised to send you around to different departments within this hospital and also to other associated hospitals, and then really excellent one-to-one tutorials from the doctors where they'll sit down and take you through a topic in detail, both to help you learn the medicine but also to prepare you for what you need to pass all of your exams this year.
So another advantage of being at the Central Clinical School is its proximity to the university, in that you can go over there to use the resources at the library or go to see some guest lectures, for example. It's very useful. Also, you can be part of the university community. You can continue to do sport or other recreational activities as part of the university, and it's very easy to go between the two. Also, being located here in Camperdown and Newtown, there are cafes, there are restaurants, there are bars, there's everything you can possibly imagine for entertainment. I think a lot of people choose to live nearby so that they can really make the most of the experience.